What is immunotherapy?
It is a form of treatment which uses the body's own immune system to kill the cancer cells.
What makes immunotherapy different from the traditional chemotherapy?
Chemotherapy acts not only on the tumor cells but on all rapidly dividing cells of the body. But immunotherapy is not like that. So it will act only on the immune system which gets activated to kill the tumor cells.
Now that we spoke about benefits, what are the factors that qualifies one to be considered okay to be able to proceed with immunotherapy rather than traditional chemotherapy approach?
I have many patients in the OPD who come to me and say that can I take immunotherapy and may I, and they ask may I not get cancer.
Hey everyone, welcome back. Today we are here to discuss about one of the most promising developments in cancer care, immunotherapy. And to do this, we have with us Dr. Sreevalli A, Consultant Medical Oncologist, Manipal Hospital, Bangalore. Welcome, ma'am. Ma'am, there's been a lot of buzz around immunotherapy lately. So what is immunotherapy?
So if we look into the treatment of cancer, it's completely evolved. So initially we were in an era of only chemotherapy. But if you see, 10 to 15 years down the lane, people would come, will I be treated with chemo? But now we have something else called as immunotherapy, which is definitely a boon to our cancer patients. So what is immunotherapy? It is a form of treatment which uses the body's own immune system to kill the cancer cells. Okay. So unlike chemo, which acts not only on the tumor cells but also on the other normal cells like hair, which are rapidly growing, skin, nails, ovary, the mucosa of the gastrointestinal tract. So what does immunotherapy do? It doesn't act on all those. So it mainly activates our immune system and it's tumor specific.
Okay. So when you say how is the process carried out? Like how does the immunotherapy facilitate the body's immune system to help combat the cancer cells?
Yes. So whenever a cancer cell enters the body, what does it do? It behaves like a thief, but behaving like, a family's own relative.
Oh, as a part of...
so it comes into your house and it hides. So how does it hide? It will go to our immune system and make it believe that it is not something non-self, but a self, as in a part of our own body.
Yes.
So there are these something called as checkpoints which are actually activated. So what are these checkpoints? They will help us to dictate the immune system, the T cells and the B cells which are all there, should you really fight that particular cell and kick it out. So these kind of checkpoints are activated, so there's a break, because of which our immune system doesn't function to kill the cancer cells. Hence the cancer cell flourishes, it develops its own tumor milieu, it develops its own blood cells, T cells and all that which are already sleeping, and it metastasizes, invades the vessel as well and spreads the disease.
Okay. Can immunotherapy really cure cancer or is it only a temporary treatment?
Yes. So like I mentioned previously, coming to the mechanism of immunotherapy, so we have something called as checkpoint blockers. So what do? They release the brake, activate our T cells to fight against these particular tumor cells. So curing cancer, that is what everybody wants. So what is the benefit of immunotherapy is it brings about a durable response. We have had stage 4 cancer patients who have taken immunotherapy for almost a year, completed around 17 cycles, continued for another year, so almost 2 years, and have been disease free for even more 2 years. So they have been cancer free for a longer duration, from the onset of the disease to the disease free, it's almost 4 years. So we will reach that particular point of cure. Currently we are in a point wherein the response is durable, long lasting, and they are disease free for a longer time.
Okay, so it's not permanent as such, right?
Yeah.
Okay. So why are some cancer patients living longer with immunotherapy compared to chemotherapy?
Yes, so the response to immunotherapy, it all depends on how hot is your tumor. So we call cold tumors and hot tumors. So hot tumors are the one, in whom the immune system is too overactive. So these are some of the patients which will have a long-lasting response. That's a durable response. So we check certain parameters, not just PD-L1. We have this PD-L1 and PD-1 which are actually present on the tumor cells and on the T cells. So when they are high, the responses to these immunotherapies are much higher. So we do certain scorings like CPS, combined positive score, TPS, tumor proportion score, TAP score, which will help us analyze will this individual be benefited or not. So when these numbers are higher, the response to immunotherapy is higher.
Okay, got it. What makes immunotherapy different from the traditional chemotherapy?
Yes. So chemotherapy acts not only on the tumor cells but on all rapidly dividing cells of the body, because of which we see a lot of side effects.
Yes.
So most of our chemotherapy patients, they will have hair fall based on the chemotherapy
Yes.
use, because hair is one of the rapidly proliferating cell.
Okay.
Skin discoloration, correct?
okay.
Nail changes, so they have vomiting, loose stools. That is because it not just acts on the cancer cell but on all other rapidly dividing cells. Yes. But immunotherapy is not like that. Okay. So it will act only on the immune system, which gets activated to kill the tumor cell. So it's very, very tumor specific. So one is from the mode of action point of view. The second one I mentioned is the side effect point of view,
Yes,
correct?
yes.
And chemotherapy side effects will be there generally, but take it from me, they are very well managed, because we have better treatments that are available, which are given to prevent vomiting, and to prevent the fall in the count that happens with chemo. Immunotherapy side effects are very less, hardly less than 5% maybe, and these are immune related side effects. Okay, so it could involve any organ for that matter, but quite rare, like dermatitis,
Yes.
okay, hepatitis, pneumonitis, nephritis. It can affect any organ and you add an itis there.
Okay.
But it can be predicted, and we instruct our patients, whoever is on that particular treatment, to watch for these symptoms and come to us and meet us.
Okay.
So these are with the side effects perspective. And administration point of view, chemotherapy, some are weekly, correct, and some are 3 weekly, some are given for like 5 days. We have a 5-day regimen, we have a 3-day regimen. Unlike that, in immunotherapy, we do not have, those kind of 5-day or 3-day regimen. We usually have a 2-weekly regimen or a 3-weekly regimen, or sometimes very rarely, 6-weekly also we can administer, I think. And cost.
I was getting there. I mean,
Isn't it?
affordability is
Yeah,
something that everyone
another,
talks about. Yes.
Different. So chemotherapy is pretty much cheaper, but immunotherapy is costlier.
Okay.
But luckily, with the advent of many more immunotherapies that are being available, and with the patient assistance programs that our companies are bringing up with, I think we are able to cater this particular boon molecule to many, many more.
That's great news, honestly.
Yes.
So now, with the inclusion of AI in everything, so how has AI impacted this space?
So that's a very interesting question. So recently I was at the ISLC Academy, International Association of Study in Lung Cancer, and my project was basically on to look at the response of immunotherapy.
Okay.
And one part of it was also included, wherein I could add on an AI to get an algorithm based on which can we find out will this patient be benefited or not. So definitely I foresee AI in that particular segment, wherein we could add on so many points, the clinical features, pathological features, which we call as the clinico-pathological features, not just that the immune milieu, not just the T cells or the PDL1, maybe even the NK cells and other TILs, tumor infiltrating lymphocytes. So many parameters can be added and seen who would be benefited. And I think when we do it on many patients, even before the starting of treatment, which we could do it on an earlier basis and see who will be beneficial or not. I think predicting, it could behave as a predictive tool maybe.
Okay.
Yeah.
Now that we spoke about benefits, what are the factors that qualifies one to be considered okay to be to be able to proceed with immunotherapy rather than traditional chemotherapy approach?
It's a very good question, because I have many patients in the OPD who come to me and say that, can I take immunotherapy?
Yeah,
and
they just
may
come
I,
randomly asking,
and they ask, may I not get cancer?
Okay.
As a preventive.
Oh, okay.
Yes. So we tell them that we are not still there. So currently the implications are only therapeutic.
Okay.
So wherein we look into what kind of a disease they have. Okay. So in the neoadjuvant segment, that is even before the surgery or a definitive form of treatment is done, to shrink the tumor.
Okay.
So in that segment, so we have benefits of immunotherapy. For example, in breast cancer, especially the triple negative breast cancer,
Okay.
gastric cancer,
Okay.
lung cancers.
Okay.
So here, along with the traditional chemo, we combine immuno,
Oh, okay.
shrink the tumor to a greater extent.
Wow. Okay.
Okay, and we look into something called as PATSIA, that is pathological complete response. So suppose we operate these patients, we do not want to see any active disease sitting there. So this is one of the benefit.
Okay.
Second one is in the adjuvant setting. Suppose the patient underwent a surgery and has come with certain high risk features. So we don't want the disease to come back again, right?
Right. Right.
So that is one area. For example, we have an esophagus, okay,
true, yeah,
and also we have in renal cell carcinomas.
Oh,
so
okay.
wherein we use in the adjuvant setting.
Okay.
We give it for a period of 1 year and we don't want the disease to come back again. Similarly in lung as well.
Okay.
Now coming to our stage 4 cancers, where
Yeah,
we
that's
commonly
yeah.
use. So especially in metastatic cancers, we look into those scorings which I previously mentioned, like the TPS scoring, CPS scoring, which helps us to find out, who is going to be benefited. And now trust me, I think from head to toe, every organ we have the indication for immunotherapy, okay?
True.
So head and neck cancers, lung cancer, breast cancer, gastric, esophagus, liver cancer, kidney cancer, melanoma, skin cancer, not just them, endometrium, cervix.
Was it the case same always, or it's now that all these organs, you can classify them to be able to be treated with immunotherapy? Was it the case always that these were inclusive, or now that we've gone through so many we've done enough research to figure out that immunotherapy can be benefiting these organ related cancers as well?
Yeah, so initially the indications weren't this much, to be honest.
Okay.
So immunotherapy came up especially in something called as melanoma.
Okay.
Skin cancers was one of the first cancers where the approval came in.
Wow. Okay.
Okay. So now it has spread its tentacles to every particular organ,
Yeah.
and also different segments,
Okay.
not just stage 4 but in the neoadjuvant and adjuvant as well, what I mentioned.
Okay.
And not in every tumor we look into these scorings. There are certain tumors wherein we need not look into, for example, kidney cancers,
Yes.
liver cancers, okay. And also we should understand we are not just giving immuno as alone, but combining with chemo to improve the response rates in certain tumors.
Oh, okay.
Yes. And in certain tumors we are combining immunotherapy with tablets as well. For example, in kidney cancers we have lenvatinib, cabozantinib.
Oh, wow.
So
Okay.
we combine with them to enhance the response and the durability. So definitely it has evolved. We have come a long way, and I would say immunotherapy has many types.
Okay.
Now in the era of antibody drug conjugates as well.
Okay.
So immunotherapy is definitely checkpoint blockers. We have CTLA4 inhibitors, we have antibody drug conjugates, and prophylactic cancer vaccines.
Okay.
So definitely it's evolving, and it will even evolve more.
That's great news.
Yeah.
Why do some patients respond miraculously to immunotherapy while others don't?
Yeah, so it all depends on how immune reactive is the particular tumor, and not just the tumor, in what stage they came with, how is the performance status of the patient, because they should be able to tolerate, right? So whenever we plan a treatment, it is patient, tumor, certain other parameters which we look into.
Is the treatment painful?
Not really, not
Okay,
really. So
okay.
this is one of the commonest questions which patients
Everyone has,
ask.
yeah.
It's nothing but the drip.
Okay.
We
okay.
would have taken an NS or kind of a DNS when we are very
Okay,
tired. So there's an IV cannula put in,
Okay.
and it goes in the form of a drip.
Okay.
And it quite finishes early when compared to chemotherapy.
Oh, okay.
Hardly around an hour or so. Initially around 90 minutes. They're tolerating it well. We can come down to 60 minutes. So it finishes quite faster.
Okay. Can immunotherapy improve quality of life along with survival in cancer patients?
So this is one of the, what can I say, the best benefit we have got out of immunotherapy.
Okay.
So we have patients with good quality of life.
Okay.
So they might be having, like I was mentioning previously, not just cancer but diabetes, hypertension, kidney disease. They may not be fit for chemotherapy.
Okay.
Or chemotherapy may be contraindicated in these patients, but we can use immunotherapy.
Oh, wow.
Yes, so it
Okay.
is safe in those segments as well.
Okay.
Even those with a cardiac problem, with a lesser ejection fraction, we can use this.
Okay.
So it is quite safe, and it improves the quality of life, because unlike chemo, which acts on every particular organ and side effects are more, and they have to do weekly blood test or 3 weekly blood tests, here we monitor certain things like cortisol.
So is there any final message that you want to give to our viewers?
Yes. Definitely immunotherapy is a boon to the modern world, but using it judiciously is of utmost importance. So meet your oncologist, find out, are you really eligible to this particular treatment? Go through the sessions with ease, and definitely not just have a good response, a durable response, but have a good quality of life as well.
Thank you so much, ma'am, for joining us and sharing your insights with us.
Thank you so much.